Hello, I'm Michael Clark from Clark's Healthcare, and I'm excited to be with you today to talk about an important subject, which is the health implications to silver amalgam fillings and their non-toxic alternatives. Now, like a lot of people, I had a number of silver amalgam fillings, and through my studies with people such as Paul Check and Emma Lane of the Check Institute, David Geloff from the Price Partner Nutrition Foundation, also people like Dr. McCullough with McCullough.com, I discovered that my so-called silver amalgam fillings were in fact 50% or more mercury. Now, for those who don't know, mercury is very well researched. It's a known neurotoxin. It has serious health implications to the brain, the nervous system, the kidneys, and has even been shown in many cases to accumulate in the body of an unborn child. So, as you can imagine, I wanted to discover for myself, is the mercury in my mouth potentially putting my health at risk? And that's what I did. I looked into the research, and I was surprised at just how much research there was regarding this subject, and it shows that in a lot of cases the mercury does leach from the teeth. So I didn't want to put my health at risk, and I decided to have all of my mercury fillings removed. And that's how I came into contact with Dr. Marina Carew, who's an expert in this field, and she removed all of my mercury fillings. She is a member of the International Academy of Oral Medicine and Toxicology, the British Society of Mercury-Free Dentistry, the Holistic Dental Association. She's a former editor of the Women's Dental Journal and has worked very closely with experts such as the world-renowned pediatric Kleinhardt. So without further ado, I'd like to introduce you to Dr. Marina Carew. Thank you for joining us today.
Welcome, Michael.
Yeah, how are you?
I'm good, thank you. How are you?
Very good, very good. For the benefit of people watching, it'd be really interesting to know how you first became involved in mercury-free holistic dentistry.
Well, I'd heard about the effects of mercury amalgam fillings on people from my mother, who's German, and the Germans are very much into health, and a lot of her women's magazines that she used to buy mentioned mercury amalgam fillings and how they might be damaging to people's health. So that's when I first heard about it, but I didn't take too much notice because that was my mum. And I was taught by the British Dental Association that once the amalgam is set, the mercury doesn't leach out. So it's fine, it's safe. So I believed what I was taught at dental school. And in 1997, just a few weeks after I'd given birth to my fourth child, I had a car accident. And at the time when I went to hospital, I was told I'd never work again. But I decided I didn't know what else to do with my life and I would work again. But it meant I had to have 7 months off work. And while I was off work, I went and did some courses that I wouldn't have done otherwise. And one of them was about orthodontics, something that I didn't particularly enjoy, but I felt I needed to know a little bit more about, just to help my patients, not especially to do it. And I met some people that were into, some Irish dentists actually, who were into mercury-free dentistry. And I had a chat with them and started to think about it, did a little bit of research, then happened to be lucky enough to meet Dr. Dietrich Klinghardt, who for more than 20 years has been against the use of amalgam fillings in practice, and went and did some of his courses and then did some more research and was quite stunned at what I learnt. And at that point I decided, when I finally did get back to work, that I would be a mercury-free dentist. And that's what I've been doing for the past 15 years.
Yeah, I mean, obviously not from the same perspective, but when I looked into my own research, I was shocked at just how much research was showing that the mercury does leach from the teeth, and the health implications of that. I was really quite shocked how much information was actually available if you go and look.
There is a lot, but there isn't an awful lot in the, as far as I'm aware, in the medical and dental sort of journals, because, well, the British Dental Association, it's very difficult for me because I am a general dentist and I have to abide by the General Dental Council, the GDC guidelines, and they say that mercury in amalgam fillings is absolutely safe. And as a dentist, I'm not allowed to say it's not safe. Okay. But what I do say to my patients is that I don't have any in my mouth. I used to have them and I had them all taken out. And I would advise them not to have any more done. I don't tell my patients they need to have them all taken out, because I think personally I feel that's not a right thing to do, because everyone needs to make up their own decision, and it's not it's quite an expensive procedure for some patients if they have large ones and several of them, and so it's costly, it's time consuming, and it can lead to further problems with teeth if a nerve dies or a tooth breaks down even further when we're taking the amalgams out. So it's not something I recommend people do lightly. So they do need to understand the implications of having them taken out, and time, cost and further problems. But I recommend that, you know, that if they do need any fillings replacing or they need any new fillings, not to have any amalgams placed and to have white fillings, because they look better, they taste better. So even for those reasons, let alone what I perceive to be the health benefits. But as I said, I have to be very careful what I say because of the General Dental Council guidelines.
With some of the research I've been reading, I heard a statistic, I'm not quite sure where the source came from, but up to 50% of dentists now don't use mercury at all. Have you found a similar sort of experience?
I think there are larger numbers not using amalgam, particularly the younger dentists. There are a lot of older dentists were brought up, you know, in their dental school days using amalgam, and they use it. But of course, in the NHS, that is still the most widely used filling material because it's cheap, it's easy to use, and it's not as technique sensitive as a white composite filling is.
Mm-hmm. I mean, how do you feel that the popularity has changed? I mean, I can only vouch for the patients we see in our general clinic, but there seems to be a lot more awareness of non-toxic alternatives, also the possible health complications of using mercury in the first place. Do you feel there's a growing awareness of this, probably with the population or medical community?
Definitely. There's definitely a growing awareness, and I think a lot of that's got to do with the internet. Because I get a lot of people who come in who've got health problems, and they've done a lot of research, and they've looked into their diet, they've looked into all sorts of other things, and then they still can't find a solution to their problem, and then they start finding out about mercury, and then they come in and see me and say, can you take my fillings out? And I'm happy to do that, as long as they understand that it's, you know, time consuming, and it can be in some cases costly, and it can, you know, there is a small chance that there could be further problems with the teeth. But if they're going to have them taken out, then we need to make sure that they're taken out safely to protect the patients, because the last thing you want to do is take out an amalgam filling and release a whole load of mercury vapour that they then inhale. So they might get rid of their amalgams, but then they've still got a whole load of mercury that they've inhaled, in addition to the mercury that's already residing in mostly the fatty tissues and organs.
Yeah, I mean, obviously from my own experience, I had a number of amalgam fillings, and you very carefully, I know it's very different than going to a standard dentist. Could you explain a bit more about the precautions that you put in place, obviously with me or other patients, to, like you say, keep them safe from exposure?
Well, about keeping the patients, I was taught a protocol. There's lots of protocols around, but I was taught one by Dr Dietrich Klinghardt, and I found his to be safe and effective and more natural. So I like the patients to go and get some nutritional support by a healthcare provider. A lot of patients are referred to me by a naturopath or people like yourselves, and so they're already well aware of how they need to be getting nutritional support. But for those that don't, I do have some people that I can recommend to them, or I advise them to go and find a nutritionist of their own who can help them with the process before they have their amalgams taken out, during and after. And once I'm happy that they are doing that, then my protocol is that when the patients come in, before they come in, we give them charcoal to take, activated charcoal tablets. They need to take roughly half an hour before their appointment with me. When they come in, I do advise them that they should be on a high protein, low carbohydrate diet with lots of water to drink, and lots of fruits and vegetables, sulfur containing foods such as eggs. But again, I stress that I'm not a nutritionist, so they do need to get proper nutritional advice. And when they come in, we cover them up with a nylon cape, really, so that only their face is exposed, because the mercury vapor, mercury loves fat, so it will adhere to the skin and go through it. So we need to cover as much of their skin as possible. So I use a cycling type cape that just exposes their face. Then after I've made them numb, I give them, I put something called a rubber dam on, which is a clamp around the tooth, and you have a little plastic frame, sorry, not a frame, a little rubber sheet with little holes in which the teeth poke through, and that stops things going down the back of the throat. And that also protects this area around here. Then we put damp pads over their eyes, cotton wool pads over their eyes, and glasses, and finally an oxygen mask. I then use a special new drill bit for every patient that is tungsten carbide, and it's got cross-cut fissure, but we call it cross-cut fissure burr because that actually can cut the amalgam out rather in big chunks, rather than using a diamond burr, which would mean you drill it out, which generates more heat and more mercury vapor. And the actual drill bit that I use is a slow-speed, high-torque drill, unlike the normal ones, the high-speed drills, because again, if it's cut out with low speed and high torque, then you get less heat generated and less mercury given off. And what I do is, before the patients come in, I advise them that if they have a lot of amalgams to be taken out, we'll do what we can over a 2-week period, and then if there's more to be done, or they prefer to have it done over a prolonged period of time, we do what we can over 2 weeks, and then we have to leave it at least 2 months for the body's immune system to get back to normal. I also don't do make the appointments the same time of day or the same day of the week over that 2-week period because of the biorhythms. And the other thing I do is I will do treatment either on the right side or the left side at one appointment. I don't cross the midline. So if someone comes in who's got just 2 amalgam fillings, one on the right, one on the left, even if they're small, I will book them 2 separate appointments. If they're on the same side, I'm happy to do them at the same appointment. And that is because we don't want to cross acupuncture meridians. Okay. So I've done all of this according to Dr. Klinghart's protocol, and in all the years that I've been doing it, I've never had anybody come back and tell me they've been particularly sick. I've had a few people telling me they were tired or they had a bit of a cold afterwards, but generally patients, even really sick ones, cope fine with it.
Yeah, I remember my own experience. I mean, I'm lucky I'm in good health, but I had quite a few of you, as you can remember, and you very carefully looked after me, and it was interesting going through the experience, but I did feel really well cared for. But the first thing I remembered, I wasn't expecting anything specific. I just didn't want them in my body in any shape or form. But for the first 2 nights, I've never slept so well. It was really, I was really shocked.
You didn't tell me that before.
I kept that secret. I felt absolutely fantastic. It really was quite shocking. My wife can account to that. I wasn't sleep talking or anything like that. Wow. I felt a lot better.
Well, when I had mine taken out, I am honest with patients about this. I had mine taken out probably about 10 years ago, and when I had mine taken out, instantly after I had the last one removed, because I had them on both sides, so I had to have them over 2 sessions, instantly I'd had the last one taken out, my catarrh went away completely, and the metallic taste. But apart from that, I didn't feel any different. But then again, I am exposed to it all the time.
Yeah.
But those 2 things were noticeable. No more catarrh from the moment I had the last one taken out, and no more metallic taste. But those are the only 2 things that I've noticed.
Yeah. I mean,
it's fantastic that you.
Yeah, I genuinely felt it's quite
really positive.
Yeah, and I had no specific health complaints. And remember a story with David Gedoff from America, and he's taught me quite a lot about different aspects of detoxification and so on. But he was telling me a story of for a friend of his which had tremors for a long period, I think since childhood, and he had his amalgam fillings removed, and within a few days they just disappeared. And obviously there was all, like I say, all the nutritional support and all the things which went around it, and an expert like yourself. But that was one of the first things which went. But also from what I've been reading from a lot of papers, people with neurological problems and so on, I've seen a lot of links to that. Obviously both sides, but it seems to be a lot of evidence to support the possibility that it can be seriously affecting your health.
It affects so many enzymes in your body, and it apparently just Mercury, I can say Mercury affects just about every system in your body, your endocrine system, your nervous system, your digestive system, you know, everything. It gets in everywhere and can cause problems in every single system, and it causes problems with enzyme reactions. But because it causes so many problems, it's different with different people, and I think that's why the medical profession aren't recognising it.
I read a recent report to do with the European Commission, and they was pushing for 27 European countries to rule out, over the next few year period, complete use of mercury in fillings. I thought that sounded very promising.
A lot of European countries already don't use it. Okay. Germany banned its use in the early 90s for women of childbearing age and children. Sweden banned it in the early 1990s. Finland advised dentists not to use it, and if they wanted to use it, to have a really good reason. That was a few years ago. Talking to patients that have been abroad, and they say that, you know, very few dentists that they know of put them in Belgium, and they don't put them in I think it's Poland. They do very few of them, and I've had some Russian patients and they don't have amalgam fillings. So it seems to be a lot of the European countries are not putting them in, and these aren't people that have gone and specifically asked for white fillings. They just don't get them.
Don't use them. Yeah. And the other thing which I thought was interesting, as you said, I know obviously we're talking specifically about the mercury component, but, you know, expectant mothers are told don't eat fish which has possibility of any mercury. You can't use any the old anaesthetics which one time contained mercury, yet it's still being used on a daily basis in many different clinical settings. I find it quite surprising.
Yeah. Well, we are advised against putting amalgam fillings in pregnant women, and that's been in place for many, many years. I can't remember when, but I think the early 90s it's been in place that we can't put amalgam fillings in pregnant women. Not that I would anyway, but it was always the guidelines that you don't do it just in case. And of course, you know, then there was all the thimerosal, the mercury in the vaccines. So mercury is still used a lot. And, you know, that I just feel we have no place for it.
I mean, my understanding, I don't know if I'm correct on this, but the use of mercury sort of goes back 150 years to something to do with the American Civil War. It sounds like quite a long, you know, been used for a long time. It has,
and there's been lots of wars between the dental profession and the current American Dental Association that was formed by some dentists who were for mercury in amalgam fillings, because what happened was some French dentists went over to America and they made amalgam fillings out of mercury and metals, because mercury is amalgam fillings are 50% mercury and 50% an alloy of different powdered metals, silver, zinc, sometimes there was copper in it, and so it was cheap and easy to use, so it became the fashionable thing in America. And some of the older dentists didn't like the use of mercury and were very against it, so a new American Dental Association was formed, and that's how the current American Dental Association stands, that they believe that mercury is okay. And interesting, I have a brother who's a dentist in Seattle, and he thinks I'm a bit nutty, well, really? Extremely nutty. He thinks I'm a quack because he has done a degree at Seattle University, postgraduate degree, and he believes that mercury is still absolutely fine to put in amalgams because it stays there once it's there. So, you know, even in families you have disagreements.
Well, I guess also with any view in the medical industry, there's going to be some evidence to support it and some evidence to disagree with it. Really, regardless of any opinion, there's going to be fors and against, isn't there?
There is, but I think a lot of the evidence is has been gathered from, you know, biology papers and chemistry and biochemistry, not so much in the medical and dental field, because I have people who are chemists who come in and say, well, you know, I know about mercury, can you take my amalgams out?
Right.
And interestingly, I look at IT experts as well. I don't know if that's because they spend all day on the internet, but a lot of IT experts come in and ask them taken out, to be taken out. So, and then you get people who come from abroad who are actually shocked that we still put them in. Well, I don't, but, you know, that's my fellow country, you know, fellow dentists in this country still do put them in.
I think, you know, this is just my personal view, but I think calling them silver or amalgam fillings, I think is misleading, if you actually use the term mercury in there, a lot of people I think would be put off with the general use. It seems a little misleading to me.
I would tend to agree. We've always called them silver or amalgam fillings. Silver because of the silver colour, and amalgam because they're amalgamated of a whole load of metals and mercury.
An interesting video I watched, and I actually see you one of your recommended
smoking
videos.
Tooth?
Smoking teeth. I've seen that many times and recommend a lot of patients to watch it. So you can find an abbreviated version on YouTube. But if you have any concerns or disagree with anything we're saying here, I strongly suggest anyone watch that video. It's very powerful, showing you can actually visibly see the mercury vapour coming off the teeth when they're doing simple things like pouring water over it.
Yeah, and brushing your teeth. And I think the other interesting site is the International Academy of Oral Medicine and Toxicology.
Mm-hmm.
They're by a whole bunch of guys in America who are very anti-amalgam, and they were headed up at one point, I'm not sure if he's still head of it, by a guy who was head of, I think it was biochemistry at Kentucky University, and he's done a lot of, Boyd Takeley, he's done a lot of work on mercury, but there'll be a lot of papers in there and research that you can have a look at, and they also did produce a video at one time where they showed they got in the university of one of the universities in Canada, they got some snail nerve cells and they put them in a petri dish, and they look like little stars with very long tendrils. This is for all people that don't know, what a nerve cell looks like.
Yeah.
But it looks like it's sort of star shaped with lots of at the points, lots of tiny little tendrils that go out. And what they did was they put these in. They had these in a petri dish, and they put very dilute amounts of different heavy metals. And they found that when even in the minutest amounts, the mercury made all the dendrites, all the little tendrils shrivel up into balls, very much like you find in Alzheimer's.
That's very concerning, isn't it? That makes sense why, like I said, the research I saw, and I got a lot of research actually from Macola.com, which I thought was interesting.
Yes, Macola is a brilliant site for that, yes.
Yeah, I recommend a lot of patients, as you said, you can find any information on their videos, and it links to other sites, and I thought it was interesting to actually be able to pull up the research papers, because it's got obviously all the references there.
Yes.
But the main sort of thing I saw was the neurological implications. But based on that study, that makes a lot of sense where that's come from.
Yes.
Yeah, and also because the mercury sort of 150 plus or so years. I imagine there must be a wealth of new non-toxic alternatives which can be available.
Well, there has been a scare about the composites because they believed that some of the problems with the composites were that they had an estrogen part to them, which could cause problems with boys. But at the end of the day, what I tell my patients is that there is no completely biocompatible material to put in the mouth. There just isn't. One of the most biocompatible materials is zirconia, but you can't do fillings with that because it's very hard. That's actually a rare metal, not a heavy metal. It's like the zirconia you get for false stones, diamonds and things. That is one of the most biocompatible materials, and there's nothing that is completely 100% safe. But if you're weighing up between having a mercury filling or a white filling, you're better off going for a white filling. Absolutely. Even though it might be leaking out a little bit of things, sort of things that are not particularly brilliant for the body, but nothing is. So, but then again, if you have a hole and you get all the decay from that and all the infection, that can cause problems, even worse. So everything is a compromise in dentistry, unfortunately. There's nothing that I would say is completely safe to use, but there are different products that are better than others, and I would say that I personally would say that I would prefer to have a composite in my mouth any day. In fact, that's what I do have than an amalgam filling. And I think we've got we can't tell patients that what we're doing is completely safe because we don't know. But at the end of the day, you've got to weigh up which is the safest option.
Absolutely.
And at any time, I would choose a composite or a zirconium restoration any time over an amalgam.
That makes sense. I mean, with the sort of the materials you use on a regular basis, do you find they're as durable as amalgam?
They used to be, they used to wear a lot more, and they weren't as strong, all the composite materials, but over the years they've been developed to be strong and durable, and quite well lasting. Unfortunately, when you have very big cavities, you do need to use, the patient is better off having an inlay placed, made out of porcelain or a composite that's been light and heat cured, because it wears less. And one of the problems that you have with composites is that when they are cured in the mouth, they're never 100% cured, and you also get a little bit of shrinkage. So the bigger the cavity, the more shrinkage you're likely to get.
Right, okay.
And when you don't get such a brilliant cure, because the only way to cure composite completely 100% is to do it under light heat and pressure, and obviously you can't do it under heat and pressure in the mouth.
No.
So the composites don't get 100% cure, and you do get a bit of shrinkage, but because they don't cure 100%, you do get a little bit more wear, but they wear more or less the same as not amalgam, enamel these days. So that's quite good, but the bigger they are, they do wear more quickly. So in those circumstances, your dentist might advise you to have an inlay, which is going to last longer because it won't wear as well as quickly. And as for when you do an amalgam filling, the problem with amalgam is that when you put it in, it's soft and then it hardens up, but it doesn't actually bond to the tooth at all. So the only way you can hold it in is to make the base bigger than the top part,
right,
so that when it hardens, it doesn't get pulled out when you're eating. And in some cases, if there's a lot of tooth missing, the dentist has to drill some little pins into the tooth to help hold the amalgam into the remaining tooth tissue, put some tiny little self-tapping pins in, and research has shown that they can cause tiny weeny little cracks around them. And it also weakens the amalgam, but it helps hold it in.
Right.
And whereas with white fillings, they're actually bonded directly to the tooth, which means that you can have a smaller cavity, you can just drill out where the decay is and just do a minimal shaping, because you don't have to make the base bigger than the apex, because the composite's actually bonded in, and you don't need to use pins because again it's bonded to the enamel and the dentine.
That's got to be a lot better for long-term health of the tooth.
Yeah, and it can make the tooth stronger.
Marina, we've talked obviously quite a lot about the alternatives there are, and a lot more about obviously the amalgam. I know we briefly touched on it before, that there's a lot you can do to prevent dental decay or other dental problems, particularly nutrition support and so on. So would you like to expand on that a little bit?
Well, again, I have to say that I'm not a nutritionist, but when patients come in who've got quite a lot of decay, there is some evidence, there is some research now that there is high incidence of decay linked to gluten intolerance. I think a paper came out in about April time, so that people who are gluten intolerant are more likely to have tooth decay.
That's interesting.
So that, I think, can be found on a gluten-free society website. And certainly when patients come in to me and they have decay, I do recommend that I ask them about vitamin D, if they're taking any vitamin D supplements, because vitamin D, I know, helps protect against tooth decay as well as 17 different types of cancer. So I do recommend patients take vitamin D, or at least research it, because again, I have to be careful what I recommend, because I'm not a nutritionist. So I tell them to look up vitamin D and to make sure they take a decent dose of vitamin D. Vitamin K also helps your body uptake the vitamin D, so that's quite important. I'm not a great fan of fluoride, but again, against the GDC guidelines, which say that fluoride's fine, I tend to steer away from fluoride.
That could be a whole other video, couldn't it?
Absolutely. So I don't, and also, probably a lot of people don't know this, but fluoride is also aging, because it interferes with the collagen.
Didn't know that.
Yeah, the cross-linkages in the collagen, it interferes with that. So, for all of us women, well, even the men who are worried about ageing.
I know, I'm 78.
Well, I'm 105. But anyway, yes, collagen, it interferes with the collagen. So So when people come in to see me and they've got a lot of tooth decay, we do talk about diet, because obviously sugar is implicated, and fermentable carbohydrates.
That's what we're referring to as starches, flours.
Yeah, starches and flour, and and that goes quite well with what I was reading about the gluten intolerance. And of course, if you've got candida, because that comes up in the mouth. So high protein, low carbohydrate diets, with good fats. You need to have good healthy fats. I don't believe in a low fat diet. Lots of fresh vegetables, not so much on the fruit side, although I do believe that a lot of dentists are talking about acid erosion now, but I'm sitting on the fence a bit about that, because I think we do need to eat. I don't think people need to feel guilty about having fruit juice, but again, fruit juice, you've got to be careful of the sugar in it, more I think than the acids, and it's eating between meals that can also cause problems. So if you are going to eat between meals, cheese, something like that, which gets the saliva flowing, is good. So on a nutritional front, I just say just the bits that I know, and that is one of the great supplements that I like is chlorella. Chlorella is a freshwater algae that's been around for millions of years, and it removes herbicides, pesticides and dioxins, and more importantly, heavy metals. It's got lots of good vitamins in it, glutathione, which is an antioxidant which helps remove heavy metals. The only thing is there are a few patients who can't digest the cell wall and find that it difficult, in which case they need to take something like NDF, which is nanonised chlorella, but it is quite expensive. And the other thing that I have heard of some dental colleagues who are obviously quite mercury toxic from having putting amalgams in, they need to take a huge handful of chlorella to stop them feeling sick. Really? Because one of the problems is if you take chlorella, it starts to mobilise the heavy metals, and if you then you don't take enough of it, it mobilises heavy metals and makes you feel really ill.
Because it releases into the bloodstream.
Yeah.
Right.
And so there are some dentists who I know who have to take a whole handful of chlorella to stop them being sick when they take it. And that takes quite a leap of faith to actually think, I'm taking these tablets and they make me feel really sick, and the more I take, the less sick I'm going to feel. That's against all of what we believe in. But I have known some dentists that have to take a whole handful to stop them feeling sick because they can't tolerate taking 2 or 3. So chlorella's a big one that I like, and getting some decent omega-3s, and eating eggs, free range, omega-3 boosting eggs, because apparently I went to a talk and apparently the omega-3 eggs are better for you even than the organic eggs.
Okay.
So that's what I've been told. So again, I just tell patients what I think they can cope with, and also that they need to seek nutrition advice from someone else. But as regards to candida, if I ever have to give antibiotics, which is very rare, I do get patients to take alongside it probiotics, because I think that's really important. And the thing that Dietrich Klingholt taught me about candida was that your body grows a garden in your gut to protect you from the heavy metals. And so a lot of people who have candida, when they go on an anti-candidal diet, you might well have come across this. They go on an anti-candidal diet and then feel really, really ill, and they call that the Herxheimer's reactions. And Dietrich believes that what happens is you kill off the candida and it releases all the heavy metals. So if you're going to do anti-candida diets, you need to be taking something that's going to take the heavy metals up and get them out your gut. Chlorella is very good for that. And
as you said, it brings back to the whole thing of nutritional support, because your immune system, your detoxification systems, so I know we're sort of digressing slightly, but they need to be strong to be able to cope with that. That's why you said it's weighing up, and this is obviously why it's good to have experts like you who can say we're better off leaving it alone, or we're going to do this over an extended period or close together, rather than someone simply removing them.
Yes. And the worst thing you can do is have one done every month or something. You need to have a period for your body to recover, and that is, Dietrich says, about 6 weeks to 2 months.
Right, yeah. I mean, one of the things I thought was interesting was the works of Weston A. Price, And I've spent some time with the Price Partner Nutrition Foundation, who they're fantastic, ppnf.net, I believe, if I can remember right. But, Weston A. Price travelling the world, looking at different civilizations, and particularly looking at the effects of what people eat in different parts of the world. So obviously people close to the equator would have a lot more sugars and things like that. Myself, I'm white-skinned, Northern European descent. My ancestors wouldn't have had access to lots and lots of fruit juice and things like that. It would be a lot more meats and proteins. And if you ever get a chance to read the book, it's really, really good. It does show that people eating their very traditional foods, so it did include, like say, healthy fats, meats. These were the times where food was all organic, so you didn't have all the chemicals and other things. But their teeth was fantastic, even without toothbrushes.
And not only their teeth, but the shape of their jaws was different.
Yes, yes.
They had very nicely shaped arches, which, nowadays we don't see so much. We see very narrow arches, and the children go to the dentist at the age of about, 12 to 14 and get told, oh, you've got very crowded mouth and your teeth are too big for your mouth. And really, I believe, again, this is going against most of the dental professionals, that it's actually the jaws are too small.
Okay.
And the jaws, that comes from diet. Very little of it is genetic. And the other thing is children nowadays have a lot of allergies. So when you get these young children who have allergies, they can't breathe through their nose, so they tend to put their noses up. They lift their head up to try and breathe better. And then their tongue, they open their mouth to mouth breathe, which is one of the worst things that you can do. But if you can't help it, you've got to live, so you've got to breathe. And so the tongue isn't sitting where it should do, which is up behind the upper front teeth, the incisors on the palate. There's a little, if you put the tip of your tongue behind your upper front teeth, there's a little ridge there. And that is where your tongue should be sitting most of the time at rest. Okay. But what happens is if you've got an allergy and you have to mouth breathe, you do this. And so what happens is your tongue sits in the floor of your mouth and you get a beautifully developed lower jaw, but your upper jaw doesn't develop properly because the tongue's not functioning properly. And so you get all these tiny little upper jaws, quite often with very high palates, and then with the result that the child then, if it's a child who's developing, they end up with a very narrow upper jaw, which then means that their teeth, they ended up with a crowded jaw. And then they'll go and see an orthodontist who says, oh, your teeth are too big for your jaw, let's take a couple of teeth out. I went on this orthodontic course where I learnt that actually you make the jaw bigger to fit the teeth. And when you do that, you get amazing health benefits. And that's what I do now. We make the jaw bigger to try and fit the teeth in. It isn't always possible, and in certain circumstances you do have to take teeth out, so I'm not saying that it's all extraction free, but generally I don't need to take teeth out for people that have got crowded mouths. We make the jaw bigger to fit the teeth in, and so over the years I've come across various appliances, and I absolutely love one called the Advanced Lightwire Functional. The tiny little lightwire functional appliance that's fitted behind the front teeth, or behind the teeth, so you can't actually see it unless you have a very broad smile. You can see a tiny bit of metal, but it works like a cranial osteopath in the mouth 24 hours a day. Yeah. And it's very, very lightweight, and it was developed by a Californian dentist called Derek Nordstrom, who worked a lot with autistic children, and he also trained to be a cranial osteopath, and he developed this very lightweight functional appliance. And when I put it in patients, I believe I've done probably about 500 over the years, and I've been doing this, I've been using them for more than 10 years, and I believe that 95% of my patients get health benefits. And so as well as making the jaws bigger, I get patients whose headaches go, their neck pains go. This is adults as well as children. With children, I find that they don't need grommets, and they breathe better. You get little kids, sometimes you must see this, who've got very dark shadows under their eyes, and you think they're not sleeping enough, and actually we call that venous pooling. That is where you're not getting adequate drainage of the maxilla and the head. and that is because they've usually got a very high palate, and they're not getting enough drainage and not enough nutrition to the area and not enough oxygen. And when we use the ALF, you put that in, and it starts to very, very gently open up all these cranial sutures, and after a while the children don't have dark shadows anymore. And if they're very flat here, they suddenly develop cheekbones, and it's absolutely fascinating to see the child blossom in front of you, because it changes faces for the better. You get a beautiful cheekbones, and people who've got a very thin lip, you get women whose lip suddenly gets bigger, and they're saying, "Oh, my husband says I'm more kissable," or "I'm using more lipstick," and it's absolutely fabulous. And then you see the change in the profile. The lower jaw comes forward into the correct position, and when the lower jaw comes forward, it eases up the stress around the back of the neck and the head, and it also relieves pressure on the ear. So I've had patients, kids who don't need grommets anymore, who can go swimming now, who perhaps couldn't go swimming in the past because they had so many ear infections. I've had adults with the same. I had a lady who had, she was diagnosed with Meniere's disease, and she'd been a patient of mine for a long time, and she was happy with everything, but she suddenly developed this illness where she had vertigo and she couldn't stand up, and she was on 5 lots of medications, which meant she couldn't function. And she said to me, "What can I do?" And I said, "Well, perhaps we could try making your jaw bigger." Put an ALF in her. Within 2 months, she came off all her medication and she didn't have the vertigo anymore. And unfortunately, she did end up with another illness, which was not related to any of this, and she had to have surgery, and she had to take her appliance out. She took her appliance out, and the dizziness came back.
Right.
And she's one patient that said to me, "Please don't ever let me lose my teeth, because I need to keep this in my mouth forever." Because it's had such a huge impact on her.
Amazing, isn't it? Or as you said, even just from a very basic point of view, if you can't breathe, and you have to adopt what we call forward head posture, which we see, with neck pain, back pain, headaches all the time. Just the pure mechanics of tipping the head forwards like this is going to completely, they would have shown that every inch the head moves forwards, technically you're adding the weight of your head on top of yourself. So that's a heavy head, and you're going to wear joints out significantly faster if, like you say, you're having to adopt a faulty posture through not being able to breathe properly.
Yes. When your jaw's too far back, it affects because this is sphenoid bones. Whether they're out like that or whether they're like this, it depends on where you're. That also puts your jaw forwards or backwards. So very interesting, and we should be, as dentists, we should not be working on our own. We should be working with nutritionists. We should be working with osteopaths, cranial osteopath, chiropractors, massage therapists. We should be working as a big team, because there's not one of us can cure the patients completely. But together as a team, we have a whole lot of a better chance of getting the patients healthier. And so we should all be working together.
Absolutely.
Because I can't fix the body. I can do something to help the jaws, but the patient needs to be seeing an osteopath or someone who can do some body work to get them well aligned. And just as osteopaths can't get the jaw always in the right place, they need the dentist to open up the sutures and allow the movements to stay. So we should all be working together.
Absolutely. Like I say, we see even simple things like, how the jaw interconnects with the neck. If you can't chew properly, like you say, you can't breathe properly, it's all going to be very interconnected. And like you say, it then comes back to nutritional support. So it's sort of a whole circle of things there.
And people don't really realise how important dentistry is to their whole general health. And, I didn't know that. I was just a dentist and was trained to look at the mouth and the teeth and the gums. And that's where it stopped. And it was just through, having this car accident that it opened up a whole new world to me. And I realised how every tooth is related to an acupuncture meridian. So it's related to every organ, it's related to emotions. The jaws are really important to your posture, your muscles, the way you digest your food, everything. And so dentists do play an important role. And of course now the research has shown that if you have chronic gum disease, you're more likely to suffer from a heart attack or a stroke, or women who are pregnant, low birth weight babies, or stillbirths, because of the bacteria that are released when you have gum disease. So again, dentistry has a really important role in part to play in getting patient to be generally fit and healthy.
Yeah.
And I think that's really sadly neglected by most, of the people in the country.
Yeah.
And as dentists, most dentists don't understand that, because we all just train to look here.
Yeah, well, it's a very reductionist view, isn't it? So as you say, it's a lot more to it than that.
It is, but I'm very fortunate in that, I have come across some great people, Dr. Klinghardt being one of them, Skip Truitt, who taught me all the ortho stuff, Derek Nordstrom, I've come across some amazing, amazing dentists who have just changed my life, and through them I've managed to change patients' lives. So I'm very, very lucky.
With, obviously we've talked about a lot of different things, and we talked about safe alternatives to Mercury and so on. How does someone know, because I looked to find someone like yourself who's an expert on specifically how to safely remove these. How can people watching this say, look, I live in this area, I want to have these removed, or please consider it. How can I find someone who knows specifically what they're doing?
Well, first of all, I'd go to the British Society of Mercury Free Dentistry, and they have a list of recommended dentists. And the other thing I would do is check their websites out, see if they have their protocols on the website, and failing that, I would also phone the practice up. We get a lot of patients phone the practice up, and they ask very intelligent questions, and we can answer them, because we treat all our amalgam removal patients the same. So we have, because I have a very strict protocol and I stick to it, and I know when patients come in they ask me a lot of questions and they're testing me to make sure I know enough, and I do. I know a lot. And,
absolutely.
And some patients have some preconceived ideas about how they want their amalgams removed, but I stick to my protocol because it's what works. It's worked for all the patients that I'm aware of. No one's ever come back and told me otherwise. So I stick to my protocol and I don't waver from it. And I'm proud to be able to say when patients come in and they question me, I can give them all the answers, and that I can also tell them a few things. So I think you need to be, if you're unsure, then question the dentist or the receptionist, and if they're not particularly helpful, then maybe you need to be looking at another practice. But I'm sure that all the dentists that I know who are holistic, or even just mercury free, all the ones that I know will be very, very happy to answer any questions that the patients might have.
Well, that's it. I mean, I didn't know you personally prior to my, to coming here, and I phoned up and asked lots of questions. I hope they were intelligent questions, but
well, it doesn't matter if you ask questions. If they're important to you, then they're important to us.
Yeah. Well, thank you, Marina. I've really enjoyed speaking to you. I've learned a lot, and I've really enjoyed our conversation. We hope you found this to be interesting and informative. What we'll do is we'll put Marina's details on at the end of the video if you want to contact her, and we'll give you some other information. So thank you very much for watching. We hope you've enjoyed it. We've certainly enjoyed speaking today, and we hope this has been helpful to make an informed decision regarding your dental care. So thank you very much for watching, and take care. Bye.